Hello and welcome. Today, we're embarking on an extraordinary journey into the future of healing. Imagine bouncing back from devastating injuries faster than ever before, turning grueling rehab into an engaging adventure, and achieving recoveries that defy old limitations. This video will reveal how cutting-edge science and groundbreaking technologies are completely reshaping rehabilitation, transforming it from a slow, often frustrating process into a dynamic, personalized pathway to reclaiming your life. We'll explore how these innovations leverage your brain's incredible adaptability and push the boundaries of what's medically possible. The secret weapon? Neuroplasticity, your nervous system's astonishing ability to rewire itself. This biological superpower forms the bedrock of modern rehab. Scientists now harness this adaptability using technologies that provide precisely targeted stimulation, turning passive recovery into active neurological remodeling. Forget one-size-fits-all physio routines. Today's methods are hyper-personalized, data-driven, and astonishingly versatile. Consider robotic exoskeletons. Once sci-fi fantasies, now real-life game-changers. Meet Corey Borner, paralyzed in 2009, who walked across his college graduation stage strapped into a bionic suit. Or Megan, who regained independent walking after just 20 sessions with an exoskeleton and later golfed despite numbness in her legs. Even 10-year-old Claire, wheelchair-bound after complex surgeries, learned to walk with a cane using robotic assistance. These aren't isolated miracles. They're testaments to how machines provide intense, repetitive, precision training that sparks neuroregeneration. Meanwhile, virtual reality, VR, and augmented reality convert sterile therapy rooms into captivating worlds. Patients swing virtual swords to pop digital balloons, tackle obstacle courses projected onto gym floors, or relearn movements in simulated real-life scenarios. Companies like XR Health design these immersive experiences to distract from pain during exercises, rebuild balance, and sharpen cognitive skills, all while making therapy feel like play. The revolution extends beyond clinics. Telerehabilitation demolishes geographical barriers using AI, 5G networks, and mobile apps. Imagine high-definition consultations with specialists from your living room, or therapists remotely guiding robotic devices through your exercises. For rural patients or those with severe mobility issues, this isn't just convenient, it's life-changing access. Then there's the silent data revolution. Wearable tech like Athos smart clothing tracks muscle activity in real time, spotting unhealthy movement patterns before they cause setbacks. Georgia Tech researchers created a wearable ankle sensor using bioimpedance analysis. It detects swelling and tissue damage instantly, letting clinicians tweak rehab on the fly. Combined with artificial intelligence, these tools predict recovery roadblocks, customize treatment plans daily, and even automate progress reports. Gamification turbocharges motivation. Devices like Rejoice or Articar's H-Man turn arm exercises into interactive games where hitting targets scores points and unlocks levels. This psychological magic transforms mundane repetitions into thrilling challenges, keeping patients engaged for the long haul. And let's not forget advanced physio modalities. Hyperbaric oxygen chambers accelerate tissue repair, pulsed electromagnetic fields reduce inflammation at the cellular level, and cryotherapy uses extreme cold to speed healing. Even your own blood becomes medicine with platelet-rich plasma therapy supercharging regeneration. Together, these innovations create a seismic shift. Rehab is now precise, portable, and profoundly empowering. By blending real-time data, immersive engagement, and biological ingenuity, we're not just fixing bodies, we're rebuilding lives with unprecedented speed and hope. Ready to dive deeper? Let's explore how these technologies work and who they're helping next. We've seen the dazzling technologies reshaping rehabilitation, but what truly ignites these recoveries? It all circles back to neuroplasticity, your nervous system's biological alchemy. This isn't just about healing tissues, it's about teaching your brain and spinal cord to forge fresh pathways, reroute signals, and reclaim lost functions. Today, we unravel how today's innovations hack into this innate adaptability, transforming hope into tangible neurological change. At its core, neuroplasticity thrives on precision, repetition, and engagement. Traditional rehab often struggled with inconsistent practice or unmotivated patients. Now, robotics like the ExoGT exoskeleton deliver mathematically perfect movements thousands of times per session. Each step forces dormant neural networks to wake up by bombarding the brain with sensory feedback, pressure on soles, joint angles, balance shifts, essentially shouting, "This is walking, remember how?" For spinal injuries, studies show this triggers axonal sprouting, where surviving nerves grow new branches to bypass damaged areas. Patients like Corey Borner didn't just regain mobility, their nervous systems physically rewired. Virtual reality takes neuroplastic conditioning further by weaponizing embodied cognition. When stroke survivors grasp virtual cups or dodge digital obstacles in VR environments, their brains process these actions as real-world experiences. The motor cortex lights up identically to physical practice because VR hijacks our visual and proprioceptive systems. Companies like MindMaze use this to accelerate stroke rehab by up to 70%. One protocol has patients painting virtual walls with impaired limbs, a playful task that masks grueling shoulder rotations. As neurons fire together during these engaging tasks, they wire together faster, cementing durable neural maps. But how do we ensure these interventions hit the right targets? Enter neuroimaging-guided therapy. Pioneers like the Swiss Neurorehabilitation Network combine fMRI and motion capture to create personalized brain maps. Before a session, scans pinpoint underactive motor regions. During training, sensors track if exercises successfully activate those exact zones. One ALS patient learned to control a robotic arm via residual facial twitches after scans revealed unexpected neural reserves near her auditory cortex. This precision prevents wasted effort and strategically directs plasticity where it matters most. The revolution extends into the microscopic realm with neuromodulation. Devices like BrainsGate's vagus nerve stimulator pair mild electrical pulses with movement therapy. Why? Timing is everything. When zaps coincide with attempted motions, they amplify neural signaling like a megaphone for weak nerve impulses. Trials show patients with traumatic brain injury regain fine motor skills 40% faster when neuromodulation primes the brain before VR sessions. Meanwhile, transcranial magnetic stimulation, TMS, blasts targeted magnetic fields to suppress overactive neurons, blocking recovery, effectively silencing neural noise so new pathways can emerge. Critically, motivation isn't just psychological, it's biochemical. Gamified systems like Reflection Health's Vera leverage dopamine-driven feedback loops. Hitting targets in movement games trigger rewarding surges of neurotransmitters that enhance synaptic plasticity. Researchers at Johns Hopkins proved this by comparing two groups, one doing standard exercises, the other playing VR soccer. The gaming group showed significantly higher BDNF levels, the very fertilizer that grows neural connections. The implications are staggering. Children with cerebral palsy once plateaued in motor development, but labs like UCLA's REACH now combine robotic gait trainers with predictive AI. Algorithms analyze each child's movement data to forecast optimal challenge levels, ensuring constant neuroplastic progression without burnout. One 8-year-old, after 12 weeks of this regimen, transitioned from walking frames to jumping rope, a leap previously deemed impossible. Similarly, advanced wearables like Biosensix's PAMSES track subtle progress invisible to the human eye, detecting micro-improvements in gait symmetry that signal nascent neural rewiring, allowing therapists to instantly adjust regimens. We're witnessing a paradigm shift. Rehab no longer waits for biology, but actively engineers it. By converging robotics, neuroscience, and data analytics, we're not merely assisting bodies, we're reprogramming nervous systems with unprecedented intentionality. Next, we'll explore how these tools tackle humanity's most complex rehab challenges, brain trauma and neurodegenerative diseases. The frontier of neuroplasticity-driven rehabilitation reveals its true power when confronting conditions once deemed irreversible: traumatic brain injuries, TBI, and progressive neurodegenerative diseases like Parkinson's and ALS. Here, the stakes are higher. Neural damage is often diffuse or relentlessly advancing. Yet the fusion of cutting-edge technology and neuroscience is achieving what was unthinkable a decade ago. Not just slowing decline, but rebuilding identity and autonomy from the cellular level upward. For brain trauma survivors, recovery hinges on bypassing scarred tissue and awakening silent neural reserves. Consider diffuse axonal injury, where shearing forces shred nerve fibers. Traditional methods couldn't address microscopic chaos, but now closed-loop neuromodulation systems like neuroelectric star stem cap turn EEG readings into real-time therapy. When a patient struggling with attention attempts a cognitive task, the cap detects faint neural signatures of focus, instantly triggering targeted electrical pulses to amplify those signals. A trial at Spaulding Rehabilitation showed TBI patients regained executive function 50% faster using this neuromirror approach, their brains learning to self-correct as damaged networks synchronize with external feedback. Parkinson's disease epitomizes the battle against decay, where dopamine-producing neurons wither, freezing movement. While drugs like levodopa temporarily ease symptoms, they don't halt progression. Modern rehab tackles this with dual-pronged plasticity induction. At the University of Toronto, teams deploy AI-driven motion sensors that detect subtle gait disturbances before patients notice. Algorithms then adjust rhythmic auditory stimulation, custom beats through bone conduction headphones, to literally retrain step patterns by syncing motor cortex oscillations. One patient, Maria, reduced her freezing episodes by 80% after 6 weeks. Her brain had rewired to use auditory cues as a pacemaker for movement, bypassing faulty basal ganglia circuits. Even more radical are focused ultrasound ablation procedures guided by fMRI, which non-invasively destroy overactive thalamic regions causing tremors. Paired with intensive VR balance training, this creates a clean slate for neuroplasticity to rebuild stable motor maps without pharmaceutical side effects. ALS presents a terrifying trajectory: progressive motor neuron death leading to paralysis. Rehab innovation shifts focus to preserving communication and environmental control through brain-computer interfaces, BCIs, that exploit cortical plasticity. Pioneers like synchron stentrode implant inserted via blood vessels record motor intent signals from the brain. Machine learning decodes these to computers or robotic limbs. Crucially, it's bidirectional. When a user successfully moves a cursor, visual feedback triggers Hebbian plasticity, strengthening residual neural pathways. In trials, late-stage ALS patients typed 14 words per minute using only imagined handwriting, their brains adapting to treat the implant as a natural extension. Simultaneously, respiratory biofeedback systems combat diaphragm atrophy. Devices like BreatheSmart use gamified spirometry, turning breath control into a VR racing game where deeper inhalations speed up a virtual car. This maintains critical respiratory muscles while dopamine rewards cement neural commitment, delaying ventilator dependence by months. For stroke-induced aphasia, where language centers are damaged, transcranial direct current stimulation, TDCS, plus AI language apps create startling recoveries. At the Shirley Ryan Ability Lab, patients wear electrode caps that apply gentle currents to suppress overactive right hemisphere regions inhibiting speech. while an app like Constant Therapy dynamically adjusts word-finding exercises based on neural fatigue markers. One patient, David, who couldn't utter his wife's name post-stroke, regained full conversational fluency after 3 months. Scans revealed new language pathways blooming in undamaged temporal areas sculpted by precisely timed currents, turning effort into structural change. Multiple sclerosis, MS, meanwhile, attacks myelin sheaths, scrambling nerve signals. Emerging remyelination therapies like clemistine fumarate are now paired with exoskeleton-assisted cycling. The drug regenerates myelin, while robotic legs provide repetitive, resistance-adjusted pedaling that forces remyelinated nerves to fire cohesively. Trials show patients improve walking speed by 40%, proving neuroplasticity can relink even demyelinated circuits under biomechanical duress. The ultimate test lies in severe disorders of consciousness, like vegetative states after TBI. Here, multisensory integration platforms create footholds for awareness. Systems like Thimeo's Sense Project personalize stimuli, a mother's voice, a favorite scent, while fMRI monitors responses. If a patient's auditory cortex activates, therapists intensify sound-based tasks to forge connections to frontal lobes. In landmark cases at Weill Cornell Medicine, patients emerged from minimally conscious states after months of such targeted sensory bombardment sparked dormant neural coalitions. This isn't mere rehabilitation, it's neuroarchitectural resurrection. As these tools mature, they blur the line between biology and technology, offering not just recovery, but a redefinition of life after diagnosis, proving that even in shattered nervous systems, the will to rewire can be ignited, sustained, and turned into tangible human triumph.